All right, good morning, everyone.
Good morning.
Welcome. And I wanted to open up a presentation to share with you so we can get started. Okay, great. So welcome everyone to our webinar where we're here at Boost. We're going to talk about the different coaching programs that we're currently offering. And these different programs are going to speak to different goals. So this is the goal of the webinar, is to, one, share this information, but also help support you in matching which one would help you reach your goals. So, but first, who is Boost? And the head of our crew, Dr. Allison Mulcahy, is our double board certified doctor in emergency and integrative medicine. And then we also have two coaches here with us, Kelsey Barron and Kim Fleming. And they are both certified functional health coaches. And we will talk about what a functional health coach is in contrast to what a health coach is soon. And then myself, Jen Gibbons, and I'm one of the practitioners at Boost, and I'm a practitioner of Chinese and functional medicine and also a functional health coach. So the goal of today is to share some information about what health coaching is, what functional health coaching is, and also what it's not. So I'm going to stop the share for the moment and love to hear from our attendees. What comes to mind for you when you hear functional health coach and health coach? So it'd be great for you to share in the chat box. Just give a moment to see if anybody has any thoughts they'd like to share.
I know I get life coach a lot, or at least I used to years ago, and it's kind of a pejorative, but it's taken on a new steam now.
Yeah, actually, one of the coaches and the training that we've all done in functional medicine with Kresser Institute, one of the main coaches was a life coach. All right, somebody is responding and saying that it's new to them, but parallel my personal health. I'm not sure exactly.
Philosophy, I think.
Oh, probably. Thank you, Kelsey. Yeah, and that's a great point, Karen, because it really is so much about your lifestyle, and your lifestyle is incited by your philosophy and your goals and your behaviors and your habits. Anybody else like to share their thoughts around what a health coach is or a functional health coach?
There's a terrific quote from our textbook that I've loved since I first read it, and it said that coaching is not a service profession. It's a modeling profession. So it's about those lifestyle, behavioral, adaptations and changes, and just and it goes back to what participant put in there as philosophy, and it reflects the personal philosophy of the person you're working with more so than your own.
Yeah, and James Clear talks about that in his Atomic Habits book, which is a great resource if you want to get into behavior change and really exploring habits. And he talks a lot about your identity, that when you identify as a certain type of person, somebody who exercises or plays basketball or whatever. I'm trying to identify as somebody who rows now that I've got a rower. I don't know if I qualify just yet, give me some time. But this idea that, when you make it part of your identity, that the behaviors of that identity are much easier to adopt than something that you don't really identify with it. Just like somebody, I love one of his examples is somebody who says, no, I'm not a smoker, and passes on a cigarette, where somebody is saying, I'm trying to quit. This is like the first person, that is their identity as a non-smoker. And that second person is trying to claim that identity, is working towards it. Susan shared to help people reach their desired optimal health. And that's a great distinction, because you're talking about future actions in contrast to the past, which we'll talk about what health coaching is not in a few moments, but also you're integrating the health piece because there is life coaching. There is coaching for people that are trying to reach bigger goals as like in corporate culture. And there's actually a term for that too, right? What type of coach is that called? Performance coach, maybe? Yeah, I think that's like in the corporate model.
The wording there from who was that from Susan, talking about optimal health. And when people think of health, it's sometimes through the conventional lens, it's simply the absence of disease. But in the functional paradigm, we look at health as a larger continuum, and optimal is a great word to put in front of health.
Yeah, and another great one is balance, which we talk a lot in the group coaching program that we're actually accepting enrollment to, which we'll get into soon, but really thinking of health as we're breaking down spectrums, like where are you on the movement spectrum and on the nutrition spectrum and the sleep spectrum and the stress management spectrum. And really that spectrum being, as we talk about in Chinese medicine, very yin and yang, this idea of deficiencies and excesses. And so to be in homeostasis or to be in balance is in essence optimal health. So really we'll get into that nuance in the group coaching program. And definitely if you haven't already subscribed to our newsletter, please do, because this is something that we're going to be talking about in the coming weeks. But I'd love to introduce Kim and have Kim give our little formal definition of health coaching and a lot of good information. So please, Kim, share about health coaching.
Yeah, thanks everyone for sharing your thoughts around it. So health coaching is a partnership between the coach and you. It's a thought-provoking and creative process that inspires and supports you to maximize your personal and professional potential. So the idea is that you are the expert of you. You know what works for you and better than anybody else, and you also know what doesn't work for you. And as coaches, we're here to help you unlock those resources inside of you. And we're here to help you find your motivation and your reasons to change. So oftentimes we know what to do. We have knowledge. I mean, the internet's just vast with knowledge. So the knowledge is there, or maybe you've been told what to do by a doctor, and that's great. But the problem is implementing that. And as Dr. Mulcahy often says, what we do is at Boost is 10% of the outcome, but you're the one that actually has to do it. So implementing what you know is not always easy to do. And that's where we come in to help walk alongside you to do that. And as coaches, as I said, you're the expert of you, but we are the experts of change, and we have received rigorous training in a range of disciplines, including psychology, sociology, and functional health education. We use a wide range of evidence-based strategies, including things like motivational interviewing and appreciative inquiry and positive psychology, just to name a few. And during a session, we might implement visioning, goal setting, and accountability to help you reach sustainable and lasting change. So where did health coaching originate? So if we look back, it can be traced back to the ancient Greeks, who believed that physical and mental health were interconnected, and that individuals had the power to improve their own health through lifestyle changes and self-care. So as coaches, we honor you as the expert in your life and work, like I said earlier, and we believe every client has the potential to be creative and resourceful. So standing on this foundation, it's our responsibility as coaches to, one, discover, clarify, and align with what you want to achieve. So it's not our agenda when you come in to talk to us. We want to know what you want to achieve. So we work around your agenda, and we'll ask you specifically what you want to leave with, and we will align the exploration process to your desired outcomes. So on that note of exploration, we also encourage self-discovery. And so you'll learn lots about yourself, and that will help you move toward the best version of you. As coaches, it's our responsibility to elicit collaborative and client-generated solutions and strategies. So as I said as well, this is a partnership. And so what works for one person isn't necessarily going to work for another. And so it's a very individualized process. And lastly, we hold the client responsible and accountable. And so you're the one that has to have the buy-in to make it a success. And ultimately, you're responsible for your own success. But as coaches, we will ensure that the steps you want to take are within your reach. And we will help you break down processes that will work for your ultimate success. So each small success builds on the other until new, healthier habits are formed, not by accident, but by design. So I want to close this part of this section on talking about what health coaching is by quoting Dr. David Hawkins, who's a nationally renowned psychiatrist, physician, and researcher, and spiritual teacher and lecturer. And he says, what you hold in mind tends to manifest. So sometimes we're not even aware of the things we are holding in mind or the belief systems that we've never even questioned, but they're holding us back. So what you are holding in mind, so what are you holding in mind that is holding you back from what you want for your life?
Wow, that's a deep question. Not something I am asking anybody to share in the chat box. These are the types of questions, though, that we would explore when we're in our individual and or group coaching sessions. And I wanted to reflect on some of the things that Kim shared, because as being a dual coach and practitioner, that there really is this in the holistic and integrative model that Dr. Mulcahy and I work in, is this goal to facilitate a change, but with a program that is created, not only designed by the practitioner, but also by the patients. And for this reflection on what we see and what we recommend, but then for the patient to say, you know, I really like to go forward with this piece, but at the moment, this feels like we need to hold on to that. And we'll get into the nuances of how that manifests within Boost and most clinics, really. But just how the holistic model that's, you know, the origin of coaching coming back from the Greeks, and this interconnectedness of mind, body, spirit is what draws so many people to holistic medicine, but also integrative is really, I would say, under that same umbrella. So if anybody would like to share any thoughts, always feel free to write in the chat box. But we've been talking about health coaching, but we're functional health coaches at Boost. And I would love to hear thoughts around what's the difference. And while we wait for somebody to populate the chat box, I would like to clarify one piece of what has been mentioned. And when we say functional health, really what that encompasses is diet and lifestyle. This idea around your nutrition, around your movements, around your stress management and your sleep. And that being what we call the foundation of functional medicine. If you've ever explored working with a functional medicine practitioner, there is so much baseline work that is happening at the level of functional health. And one of the lures to working with a coach prior to a practitioner is to say, I have a lot of work to do around the functional health, and the behavior change is really the piece that I need to focus on. And so the value of a coach in your health journey at that point is superseding the value of a practitioner that's giving you a personalized health plan. So that being said, a functional health coach is a health coach who's trained in behavior change, but is also trained in functional health, and therefore trained to support functional medicine practitioners. such as Dr. Mulcahy and myself. So you could see at a place like Boost, where we have not only a practitioner and coaches, but we're working collaboratively. And that being said, there is an important distinction. Kelsey, what isn't a coach?
Well, I'm happy to build on that. So we are not psychologists. We're forward thinkers, and we traditionally only look to the past to understand what has helped you overcome barriers and discover how you can leverage that to move forward. We're not healthcare practitioners. We do not prescribe or tell you what to do. We help you explore and find the best version of yourself. Coaches do not do the heavy lifting in sessions with clients. And coming from a personal training background, that was my, I like to do the heavy lifting. I like to do the research. And over time, I found that was not effective. So the heavy lifting in sessions is done by the client. And that starts with the work of selecting a focus to guide each session. That work is done by the client. You may come in with a focus, or you may need to weigh out a few with your coach and decide what to spend your time on that day. Your needs as a client will drive the preferences and the energy of the agenda of each coaching call. The client self-selects goals that are of high value and interest to them. Coach is there to help drill down on the specifics and provide a positive sounding board for you as you build out weekly SMART goals and experiments to be tested between sessions. While you may from time to time turn to your health coach or patient care coordinator inside of Boost for advice on treatment and testing protocols Dr. Allison has given to you during an integrative consult, or look to draw on their experience within the practice, try to look at your coaching time as valuable me time. It is time just for you to set aside to focus on your goals and your values and what's important to you. Learn new skills, explore new possibilities, and start building momentum towards a happier, healthier you. Coaches will not persuade or judge you. We're not here to cheerlead your efforts or shame you for your faults. We will always hold in mind that you are creative, capable, and whole, fully able to design worthy changes to your diet, lifestyle, and behaviors that will benefit you and those closest to you for years to come.
Yes, so we're not really reflecting on the past like a therapist or a psychologist, and except for like to say what has worked for you before and to learn from past experience, because we are, full of our own personal journey and experiences to draw from. And we aren't functional health coaches are not practitioners. And this is where you are working with a coach, and you have a care plan where the coach, being functionally trained, is much more familiar and comfortable with functional medicine testing and treatments and the nuances of that experience, which is why practitioners such as myself, trained in functional medicine, would prefer a functional health coach like the coaches at Boost. But there are going to be times where the clinical piece is really where going back and seeing the doctor is appropriate, because the coach is not there to diagnose and or make clinical recommendations, only support in the recommendations that were made. So thank you for clarifying that. And I know that Kelsey made a couple of references to an integrative consult, which is something that we do at Boost, where people are coming in and working directly with a doctor, with Dr. Mulcahy, and are doing an integrative consult and are getting that personalized care plan. Our goal today is to not only give more insight into the coaching role in that category, but also to speak to the individual and group roles. But I did see a chat message that I wanted to respond to. Karen's asking about evaluations, questionnaires, and how they are utilized. And that's actually the perfect segue, thank you, Karen, to talking about working with Dr. Mulcahy in those integrative consults, because you are there to utilize her expertise. I mean, she's double board certified. She's worked in the emergency model. She's board certified in integrative medicine. She's trained in functional medicine. If anybody that knows Dr. Mulcahy, she is just a sponge for training and knowledge. And the things that she's doing in the virtual space with patients, in addition to what she's doing in the in-office space with patients, she's really covering all bases and is a gem to have in your corner. So of course, people can come in and schedule time with her, but she needs insight. She needs that information to evaluate and make the best determination for you. And she's doing that partially. That subjective information is coming from the questionnaires and assessments and intake paperwork that we give patients at Boost to optimize your session with her. And it is a lot of information, but and a lot of it is, redundant. That's the nature of holistic medicine. If I'm going to ask you about your digestive health, inevitably you're going to be talking about not only functionality and symptomology, but also there's going to be crossing into other systems, like how your energy system is working or how well your brain is working. And so there is a bit of redundancy to some questionnaires, but the gathering of this subjective data prior to your consults, what another reference Kelsey made was to coaches being patient care coordinators. And we function as a dual role at Boost because we're there to really fill the needs of the patient at the moment. And when you're coming into an integrative consult, we want you to optimize that experience. So what we'll do is we'll take that information prior to the appointments and supply that information to Dr. Mulcahy. So she's coming in with clarity around your situation, your current presentation, and then we're taking the notes for you. So you can be present with Dr. Mulcahy. And then after the 60 minutes, she's done her evaluation, she's provided her insight and given her recommendations. You stay on with a patient care coordinator, health coach, one of us, and we're there to help you get started, to implement, to get the test order, to get the supplements ordered, to onboard, get the handouts that you need for protocols and get started. And that same consultation allows you another hour of time with one of us in order to support you in that onboarding process. And it may not even be logistics that you want to focus on. You may be a rock star at starting a protocol and getting your blood work done and doing your stool test or whatever it is that was ordered. Maybe you want to jump more into what we're talking about here, this coaching language, this coaching interaction. Because maybe you know yourself that, accountability is a piece for you, or getting started or setting goals and sticking to them. You can use that time however is going to best serve you. And if you need more time, we of course want to make that available to you. And that's where you might want to come in and do something at the individual coaching level, or you might want to join a group coaching program. It really depends on your focus. So if Kim, if you could share a little bit more about if somebody wanted to work with a coach one-on-one, in addition to that additional hour that they receive in an integrative consult.
Can I jump in real quick before we hand it off to Kim on that?
Yeah.
Just circling back to Karen's question about how the evaluations and questionnaires are used within the practice. They are used every month that you come to see us. If it's been more than a month, we like to gather the assessments again, and this allows us to track your symptoms over time. And the gradual either improvements or lack of improvements are hard to track. It's very hard for a person to track these subtly. So by gathering this data and looking at it over time, we can tell you if you're moving in the right direction or if you're moving in the wrong direction. So that data collection process not only helps Dr. Allison hone in on what may be wrong with you and what testing and treatment is appropriate, but to ensure that the testing and treatment protocols we've been using are actually working.
Yeah, so thank you. I only spoke to it in an initial baseline perspective. So thank you, Kelsey, for speaking to it as a ongoing. I mean, if you're recommended to get thorough blood work, which is great, it's the basic blood work out there is very insufficient. It's really important that you get an iron panel, that you really understand if you really do have enough B12 and folate and different micronutrients that you're not going to get from just looking at the conventional panel. And so to get functional information via the blood work, and then to come back into a follow-up integrative consult with your coach and Dr. Mulcahy to hear her insights, to get those recommendations based off of that information, and then get next steps. Like what we'll often do is have you optimize nutritional deficiencies for 3 months and then retest and see, Or if you're getting on hormones with Dr. Mulcahy, she's going to want you to check your blood work again and just check hormones in 6 to 8 weeks to make sure that that recommendation she's made is serving you best. And it's nice to have the coach and the patient care coordinator role to be there to remind you about that follow-up, to get your hormones ordered and to get you scheduled, to inform Dr. Mulcahy before the call. Everything is about optimizing and making the process as easy as possible. So the block isn't the doing and the logistics. And this is where the block often is doing in the behavior change, which is why the coaching is an important piece at Boost, where Dr. Mulcahy has integrated it into the practice to say, you're going to spend an hour with me. I want you to work with a coach, because then you're going to be more successful. Because as a practitioner, we often have people very excited to come to us and get these personalized care plans, and they get all this amazing information, and then they just have this block with the doing. And we really want to support patients in that category just as much as getting the information. So Kim, if you could share more about why would somebody work individually, one-on-one with a coach versus, and then we'll talk about the group model after.
Sure. So Jen did a great job explaining our roles, working with the doctor and how that can relate to the support that you need afterwards. And it's really individual, whether you need support with the protocol or want to do it, just with visioning and some goal setting and some life changes in general. If you're not ready to work with the doctor yet, but you know that you have some changes that you want to make, that's where we can come in as well. And really, one of the first things we would do is kind of think about what stage of change you are in, maybe with whatever it is you want to accomplish. And without getting too far into the details of it, there are 5 stages of change. And so like maybe you come in and the first stage is pre-contemplation. So maybe that's you're not ready yet for change. So it's kind of the I won't or I can't stage. Maybe it's a loved one that's pushing you to make the change and you really don't want to at all. That doesn't mean that you're not a good candidate for coaching, because we meet you exactly where you're at. So it's kind of like taking a scenario of you want to learn how to swim, or maybe a loved one wants you to learn how to swim. It would be the pre-contemplation. You're kind of kicking and screaming doing it. If the coach tells you to jump off the diving board in the first session, you're probably going to run far, far away and never come back. But like, if we can just even explore, like, so what are the pros? Why would you want to learn how to swim in the first place? Like, maybe, what are the pros of doing it, or what are the pros of not doing it? And like Kelsey said earlier, really respecting where you are in the process and not judging you for not being ready. So maybe in that stage, we would just explore, like I said, the pros and the cons and kind of discuss it a little bit. And the second stage is contemplation, and that's like just thinking about it. So it's kind of the I may stage. So maybe I'll do this, and maybe at that stage we would just gather some research or information around the change that you want to make, or maybe just talk about, you're kind of inching closer to wanting to and seeing the value. This is kind of where the pros of making the change start to outweigh the cons for you. And then the next stage would be preparation, where you are preparing for action and you're saying, yes, I will do that in the next month. So let's go back to the swimming scenario. Maybe at this point, you're like putting your feet in and you're going and buying a life jacket so that you're ready to go in a little bit deeper and feel safe doing that. So, and then we have action stage. So you've set up your environment for success. You have your life jacket, and you have the person that's gonna, walk you through the steps, and you have surrounded yourself maybe with other people that want to learn how to swim as well. And so we explore all of those those avenues. And then the last stage is maintenance. So like you might move through those stages. They're not like linear. You might go back and forth a little bit. And so, maybe you just want to, some lifestyle changes that you need to make. That your eating maybe is not making you feel so good. And that goes back to the knowledge. You know what to do, but you're not sure you're fully invested. Or you just need a little bit of help setting, making those tiny steps towards having the success. So that would be a scenario where you might want to come in and just start some lifestyle changes with a coach before, maybe you don't feel like you need to be under a doctor's care for a specific illness at this time. But that you recognize that these changes could make a big difference in your life and the vision that you have for yourself moving forward. And maybe that's, just aging gracefully and not having aches and pains, or being there for your grandkids, or, it'd be different for everybody. Everybody's motivation is so different based on, life and where the stage that they are in life. And so those are some options of where health coaching can be individual health coaching outside of, pairing up with a doctor, can be very valuable as well. So we want to help you find those things that will give you success, no matter how small, and things will build on each other. So like I said earlier, to jump off a diving board. You're not ready to do that yet. That's okay. Just put your feet in, and we're going to help ensure that the goals that you're setting for yourself are realistic for you to handle, because those small successes will keep building on each other to create the habits that you're looking for. So then the other thing, like as we help you find your reason for wanting to change, which is really important, we might ask you things like, what are your motivating factors? And how does what you are about to embark on align with your values? Do you even know what your values are? And what is important about this to you? How will it help you not only now, but in the future? And how will it help those that are around you, your loved ones? How will it change their lives? Also, we look at, what strengths you have. Everybody has a different set of strengths, and coaching is very strengths based. And so we really try to uncover those. And like we mentioned earlier, the only time we're looking in the past is to say, how in the past have you used a strength to get you out of a similar situation or to help you through? So those are some things we might explore as you seek to make some lifestyle changes. And as I mentioned, we might explore things like, setting up your environment for success, or who is your support team, and surrounding yourself with the people that emulate the behavior that you're wanting to take on. And that can be very powerful.
This kind of leads into talking about visioning and how to prepare for your first coaching call. So as we've mentioned, you do an initial consultation with Dr. Allison, and that comes with 60 minutes worth of health coaching, which usually comes out to 2 30-minute sessions. So the way to start that off is going to be through creating kind of a vision statement. So during this time, you're going to be asked to reflect on past successes, strengths, and then identify the values which animate your life. This helps both you and your coach co-create an exciting and compelling vision. A strong vision statement produces its own gravity and begins to pull you towards it as you work with your coach each session, creating weekly experiments centered around new habits that begin to reshape your life. So at their best, health and wellness and life visions are as follows. They're grounded, they're building on current success, they're bold, stretch the status quo, they're desired, they're what you truly want, They're palpable. You speak about them as though they were already true. And they're participatory. They're involving many stakeholders. So your family, your friends, who you're going to be surrounding yourself by moving forward. Some of the questions that might come up during a vision session would be as follows. What would you like your health, well-being, and performance to look like in your life in the next 3 months, perhaps a year or 5 years? I don't know about you, but that question on interviews, where do you see yourself in 5 years? Never liked it, but it really asks you to stretch and to think, and that's where a good coach can take you and support you in that place and sit with you as you work on this. And it might be the first time in a long time you've thought about this or even set some goals out for yourself. So we kind of start there. What do you believe is possible? What are the top 3 values in your life? And how do those values link to your well-being? About your top 3 goals, or what part of your life is the most important to you? What would you like more of? What would you like less of? What excites you? I really like that question. That's usually where I start. What gives you energy each day and provides for your well-being? What would your life be like if you achieved this vision? How would you feel? What is the best case scenario? What are some possibilities you haven't considered before? So those are just some of the questions that may come in when creating a visioning statement. It's really a get to know one another time with your coach and the coach with you. So how to move forward with coaching if you're not ready for treatment. This is a scenario that might present where you're not quite ready to pursue a treatment protocol. It may be cost, it may be time, but you're inside the practice, you like what you've seen so far, and you'd like to continue moving forward, but if you just got to save up for that blood work, well, that's great because we can support you in that process. Most of the change, diet, lifestyle, behavior, that is where coaches really shine. So this is where I'd like to highlight some of the potential benefits of group coaching. And cost effectiveness is going to be at the top of the list. I'm not sure if we're sharing our slides here, but those will populate shortly. But sharing the cost with a group is really beneficial way to get you in there and get some support. Support and accountability. Group coaching provides a sense of community and support. Participants can learn and motivate from one another. It also provides accountability. Participants are going to be motivated to follow through with their goals in order to not let the group down. And you get a diversity of perspectives. Perhaps somebody is in a completely different place than you, but you can see the likeness in what they are going through in your own experience, which can be valuable for learning and problem solving. You're going to have a big education chunk. So perhaps you've just started diving into this world of functional and integrative health, and you'd like to know more. You've watched a webinar or two or read some of our blogs or all of the information that's out there. This is going to be education that's led by Jen, who was my favorite teacher in the ADAPT program, and she led functional medicine training in our courses, and she's going to be leading that in the group coaching as well. So if you'd like to get a better grasp of the basics of eating a nutrient-dense whole foods diet, how to heal yourself with food, reduce or eliminate pharmaceuticals in your life, becoming a master of behavior change, or just better understand how root cause and precision medicine works within Boost, this is going to be a great opportunity for you to grow, for you to learn, and be around people that are looking to do the same. So I think I'll hand that back to you, Jen.
There's so many reflections that I want to make from both what Kim has shared around the individual model, and then also around what Kelsey is sharing about if you really like the idea of working one-on-one with a coach, just giving you a little insight into what the beginnings of working one-on-one with a coach really involve. And it really is important, right, to reflect on what is your goal, like what is your purpose in this process. And I know I mentioned just recently about the rower, and it's one of those things where I just love the idea of full body functional movement. And I can go across the street. Luckily, I can see my lake, and I can throw my boat into the water and get out there in the world and row. But I can also go right here in my little gym. And it's really enabled me to get my 11-year-old son to get more active, one of those gaming kids that you're just trying so hard to get them to engaged. But how much of us rowing together after school has kept me consistent with my daily goal. And he's kept me accountable, and him knowing that he's keeping me accountable is helping me to keep him accountable and doing it every day with me. And it's just such a fun experience. And so that accountability piece that a lot of people need that support around. They know they should do it. They want to do it, but it's so easy to just get wrapped up in your day and just keep working and taking care of responsibilities and not take that time. So to have that accountability of your coach or the group dynamic, or, even a friend or family member has been the piece that I needed. And when you look at stages of change, I was in preparation, and now I'm in action, and I'm praying for maintenance in the movement world. If we could all be as cool as Kelsey and be so diligent for decades of their life in the movement piece. But it is where we think about each piece of our health. There's functional health in a umbrella term. We're all in different places at different points, and we all need different resources and tools. So if you really are navigating this process through the lens of the behavior change, you can see how the individual coaching model is going to be ideal. If you're really looking for that personalized care plan, whether you've done a lot of baseline work and you have plateaued and you really want to gain more momentum by getting an expert to help you support you with a care plan, then obviously coming in to do an integrative consult makes a lot of sense for where you are. But there's also people that just really need to work on their learning or confirmation of their learning. And this is where the group coaching, I think, really shines, because even though the coaching is still a piece of it, education is a big part too. And this is a wonderful opportunity to not only come in and have the group dynamic and the accountability and the reduced costs, all these things that Kelsey is shared with you, but also really jumping into what we do in holistic medicine and how we help a patient navigate their health process without having the personalized care plan, but really working through the common scenarios that manifest for most people. And it really helps people to gain the benefits of treating themselves through the functional model without the cost of the personalized care plan that comes with, working one-on-one with the doctor. And so this is where, if we talk about what we're going to do in our group coaching program, just some of the highlights, I did share that slide, but really walking into it with an appreciation of the nuance of not only functional health and how to optimize repair, but also this idea of the balance and the spectrums. And one piece that I love in Chinese medicine that I don't think gets communicated as strongly in functional medicine is the idea of treatment principles. And the coaches here are very familiar with a lot of patients we see have dysbiosis, some type of overgrowth of bacterium, and are going on a protocol to reduce those, and sometimes needing to optimize their microbiome, all information we're gathering from not only those subjective insight of the questionnaires and assessments, but a comprehensive stool analysis. And so when we're treating around this information at Boost, we're really, working on improving this terrain. And a lot of the work is chunked into treatment principles. This idea of, if you have H. pylori overgrowth, which often cause ulcers, you could see where the gut wall really needs a lot of support, where mucosal support is a treatment principle. And so when you look at a protocol and it's chunked by categories, if your gut's immune system is really weak from chronic infection or vitamin A deficiency or renal insufficiency, you might see where your immune system needs support. So there's a section for supporting the immune system. If you need to build up your microbiome, there's a support for probiotics and prebiotics. So all of this, speaking through the lens of treatment principles, I think helps people really understand and be more invested in the actual treatment side. But in the group coaching program, we talk about treatment principles and we talk about the common presentations within each session. Well, we would meet for 6 sessions, each session being an hour. And we would get into things around nourishment and nutrition and, gut-brain axis and, the microbiome and all the functionality of the gut, and really getting into nuances of the treatment principles here around those digestive supports and the different classes of probiotics, which I think people find pretty fascinating. And all the things that we provided Boost, both in office and virtually, to support you in that process, even getting into a comprehensive stool test like the GI map or food sensitivity testing like Cyrex, tools that we often use to see if you have sensitivities to certain foods, and not bigger than just gluten. And we get really deep into the movement piece. And this is where we're really going to take advantage of Kelsey's experience, and not just about, how your movement program should look, but also how matching it with your nutrition and optimizing your structure and getting into timing of movement and food, and really exploring different treatment tools that can support in that process, both in our office and also if you're not obviously living in the area of Victor, Idaho, things that you can do on your own at home. And really diving into the stress piece, and not just the coaching wing, which is huge. And us functional medicine practitioners really rely on the coaches to dive deeper into the stress piece with our patients, because saying you need to reduce your stress or manage your stress better, we all know how big that is. But looking at it through the lens of the hypothalamus pituitary axis and really understanding cortisol and the value of the Dutch test for hormone, both adrenal and sex hormones, and common treatments that we utilize, like bioidentical hormones and therapies that are done in the office. Some fun, interesting things like stellate ganglion blocks, as an acupuncturist, and seeing the value of doing a treatment around the transition of the cervical and lumbar and thoracic spine, and how profound that can be for our nervous system, and to do a shutdown restart to our nervous system and just get out of a chronic stress space. So a lot of learning around therapies. And in the sleep realm, getting into like a continuous glucose monitor and common treatments that we use to support like difficulty falling asleep, difficulty staying asleep, just the general scope of functional health through that range of treatment principles, and the functional medicine testing and how they can support you. And that's how we would wrap up, is not just envisioning next steps to the coaching model, things that you've gathered along the way, but also looking at functional testing and how that might be a great resource for you to gain some more momentum, in addition to the lifestyle piece that we really focus on through the coaching model. So I know that's a tremendous amount of information, and we obviously want to share more resources. This will be recorded and available, but also resources around not that cost slide that we briefly shared, and then also the outline for the group coaching, what will occur in each session. And also, as I mentioned, our newsletter, something where each week we'll walk through one of the sessions, so it becomes a resource for anyone, even those that didn't necessarily join this group, or maybe you'll join a future group. Though we'll always be forming them and running them based on interest. So if you really do want to explore group coaching, individual coaching, or even the personalized integrative consult with Dr. Mulcahy, the ideal way to do so would be to go on to our website, boosthealing.org, register as a new patient, and we would call you after you've completed your registration. And this is where you would share, I really like the idea of doing an integrative consult, or I'd like to do individual group coaching with Kim or Kelsey, or I would like to join the next group coaching that's forming. So definitely go to the website and or call the office, and we can support you in your next steps. I also want to make you aware of, we're going to have a webinar coming up on January 24th with Dr. Mulcahy. We have a lot of webinars recorded, available on our website. But this particular one is really getting into some spiritual level work. And this is one thing that we do in the office is ketamine infusions, which is an amazing tool to support patients around chronic pain and severe depression. But we all know ketamine has a psychedelic spectrum too. And how really when you're working on affecting the way that the brain is working, not just like neurotransmitters and thinking about serotonin pathways is what most antidepressants are focused on, whereas ketamine is working on the glutamine pathway. And so learning more about what that means and how to affect your mental, emotional, and spiritual state through some of these tools. And definitely join if you also have ideas for things that you'd love to learn more about, then we would always love to hear from you. We have a contact form on our website. That would be a great way to share ideas around things that you'd like to hear more about. So great. We are a few minutes before the top of the hour. If anybody has any thoughts, questions, shares, feel free to use the chat box. And of course, I want to thank my fellow boosters, as I like to call you guys, at Boost, and Kim and Kelsey. Always a pleasure to hear your insights and share your expertise, and hopefully we get a nice little group coaching program going very soon, and we can help people really progress in their knowledge and work towards their goals as a collaborative team.
Once you know the why, the how becomes a lot easier. So I'm hoping people will join up and learn with us and grow with us and help us do the same.
Yeah, and Kim really speaking about stages of change and pre-contemplation and contemplation. Really, it does is when I work with patients, and there's so much education that has to happen for people to understand, what does low secretory IgA mean? And so like, why do I need immune support? And what are immunoglobulins? And it's a lot of information. And I find that it is great to have that insight and have that plan, but you have to really understand it to be invested. And that's one of the values of the education piece in the group coaching model.
And it doesn't matter what stage of change you're in, there's a program for you. There's something for you to just move you to the next step, or explore about moving to the next step.
So whether you reach out to Boost or you continue on your own path, one piece of encouragement is, creating a little outline for your goals and really making them practical and actionable and obtainable. And think about it more in chunks of time. Like I love what Chris Masterjohn has shared about the idea of breaking, instead of a New Year's resolution, into quarterly goals. Very practical and a lot more staying power. So we hope to hear from you, and do contact at boosthealing.org. All right, guys. Thanks so much. Bye-bye.
Bye.
I know.